Education is a huge learning process.
So, how did orthopedics happen to you, doctor?
16, I decided to be a doctor. At 19, I decided I should be an orthopedic surgeon.
So, doctor, from being trained under different surgeons in different institutes to now training your younger surgeons, what would you advise them?
Always learn from the seniors, number one. Number two, be humble. I tell only one thing. The journey is long, but at the end, it's the very gratifying. For me, it's very satisfying and gratifying profession.
Hello, everybody. Welcome back to IKOC Diaries. Let's welcome our guest, Dr. Chandrashekar P., founder and chairman of International Knee and Orthopedic Center. Welcome, doctor.
Hi, Ravina. Thanks so much.
Doctor, being a busy surgeon in the country, can you please take us back to your early days?
You want to say my childhood days?
Please.
Oh, Ravina, I was born in a village about 10 kilometers from Hassan. Hassan is a district headquarters, about 4 hours drive from Bengaluru. I did my primary and secondary and high school in Hassan. And then my father is a farmer and a builder. Mother is a housewife and a homemaker. I need to thank my parents for creating that environment emotionally and financially so that I can concentrate only on my studies and goals. And this is how humble beginnings. And then when I was doing my primary school, it was my mother who identified me saying, you should really take studies very seriously. Huge motivator, huge influencer. And then it's my father also blended so much with my mother. Such an amazing combination, both father and mother. So they are the one who motivated, because I'm the first graduate in the home, that they had it in their mind to give the best education to the kids. And that is where it all started. She's looking to all my small tests, midterm exams, final exams. And then we're a sibling three, like my elder sister and my brother. So to give the education to us is something which I feel is the biggest motivation back in 1985s and 90s. So it's amazing. And then whatever education I got in, it's because of their motivation.
And doctor, how did medical field happen to you? What was that journey like?
So I finished my schooling in Hassan, and in class 11 and 12, I joined a prestigious residential school by name Sri Ramakrishna Vidyashala, Mysore. So here I got highly influenced by my teachers, class 11 and 12, and there the biology I started liking a lot. So class 11, I was very clear I'll be a doctor. Other than that, nothing passionate, or I was not much interest of being to any other profession. So at the age of 16, I was very clear I wanted to be a doctor.
At such a very young age, doctor. So how did orthopedics happen to you, doctor?
So when I joined MBBS, in the second year, we have an orthopedic postings for 1 month. That's in 5th term, we call it as. So that was the first time I came in touch with this wonderful branch, orthopedics, right? So and I used to tell my classmates there, hey man, look, I like orthopedics, I want to be orthopedic surgeon only. They were telling, how difficult it is to get into orthopedic. You have any idea? Because the seats available for orthopedics are very less in the state and all the country at that time. So at 16, I decided to be a doctor. At 19, I decided I should be an orthopedic surgeon. God's grace, I did orthopedics.
So doctor, after orthopedics, where were the places that you visited, where you were trained?
Once I did my post-graduation in orthopedics, I was in Bombay for some time. Then I did work in Hyderabad for some time. Then I had been to Germany for doing my joint replacement fellowships there. Then I also was in Belgium. So that is some time I spent in Belgium. Then I came back and then also went to South Korea for my shoulder training. And then I was in US for some days. So I had to shuttle continents, This is where I got trained.
So doctor, from being trained under different surgeons in different institutes to now training your younger surgeons, what would you advise them?
See, now, Rabina, I train about at least 50, 55 surgeons every year. At least there are about 10 fellowships which they train under me and then go out. Always learn from the seniors, number one. Number two, be humble. If somebody comes for an advice at class 11 or 12, doctor, I want my kid to be a doctor. I tell only one thing, journey is long. You have to do a 5.5 years of MBBS, then study for your entrance. Then after once you do the post-graduation, you have to train yourself. But at the end, it's the very gratifying, for me, it's very satisfying and gratifying profession because you're basically treating patients who come with pain because nobody visits a hospital for fun, okay? Hospital is not a mall. Hospital is not a movie theater. It's not a restaurant. I myself don't want to go to a hospital as a patient. So it's not a happy place to go. Create that happy space to the patients who come with pain and you can change so many things. Like suppose tomorrow I am doing a patients with 5 years of knee pain and then I do give them very good results. Not only the patient is happy, the entire family is happy. So here is a profession. The journey is a bit lengthier, but you should be focused. There are times where you feel as a doctor like, oh, I have given 100%, patient may not be happy. Sit with them, explain like this is what it is. I think patients will accept you the moment you are completely honest and transparent until even if there is 1% complications or 1% failure, right? Or unintentional things where you do good, but it may not recover the right way. Give time to the patients and then explain them. I think they will definitely understand. It's a learning experience every day. And whatever you have read in books, and then when you start following it, but you gain your own knowledge. So it's a huge learning process. And then if you give 100% here, then the results are good. And then you start liking the profession a lot. And for me, it's an amazing profession.
That's a great advice, doctor. Thank you.
Thank you so much.